Well,
If I could add, I would just underscore Senator Frist's point about nutrition research. The NIH spends $48.6 billion on research every year. $121 million is spent on nutrition research, a fraction of that, and yet it's the single biggest driver of all the diseases that all the institutes at the National Institute of Health are studying. And that needs to change in order to actually further study this problem. And I also think that we have an opportunity to really rethink our whole approach to treating disease, not just preventing it. I think prevention is important, but 5% of the population accounts for 50% of the costs in Medicare. And focusing on that group will create the best ROI, and I believe with CBO will create a potential scoring that allows this legislation to pass. I think it's essential we think about things a little bit differently. Prevention is important. We need to figure out how to do public health campaigns. We need public health measures that include, nutrition, education of the public, addressing the food marketing in countries. The UK just banned food marketing to kids, from during the day. Front of package labeling to help educate consumers like they do in most other countries in the world. They're far ahead of us in policy, and they're seeing the changes and benefits to their population, and yet, we're not addressing these things in a serious way. And I think this, as I said in my testimony, is a national emergency, and it needs to be treated as that. I hope the next president will declare such an emergency and put a focus on it as we did for COVID, whether we did it right or wrong. We had a focus on it, and we put resources to it, and we put efforts of the government behind it, and I think that's the kind of effort it's going to require.
thank you.